Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Welcome to AARP, Arizona Hispanic Connection, for another very informative topic. The topic today, Alzheimer's does not discriminate Latinos. Once again, Alzheimer's does not discriminate Latinos. And I have 4 guests today. It's going to be good. Hope you can share the link today. As you know, all our radio shows are Facebook Live at AARP, Arizona Hispanic Connection. So I want to ask you, if you do Facebook, to find us, follow us, and recommend our page to others. The show is Alzheimer's Does Not Discriminate Latinos. I've been wanting to address this matter of Alzheimer's for 2 years, believe it or not, since I launched this platform. I really wanted to address this matter, but, for one reason or another, it had not happened. But now I got the experts. I managed through, thanks to Doctora Adriana Perez, believe it or not, Adriana Perez, who is very well known in the Phoenix area, and she moved to Pennsylvania, I believe. And then somehow she met one of my guests today, Jason Resendez, and then she connected the two of us. And Resendez happens to be in town, and that's how this show was put together. By the way, I want to really, really thank Jason Resendez, who is one of my guests, and I will introduce all of them in just a bit, for putting this show together. It's very easy when somebody helps you to produce a show, because I have to do all the shows by myself. All right, so I'm going to ask all of you to speak close to the mic, and let me introduce my guest today. And guess what? What I'm going to do, I'm going to introduce, not in a different order. First of all, let me introduce Heather Mulder. I believe I'm pronouncing the name right. Heather Mulder. She's the Outreach Program Manager for Banner Alzheimer's Institute. Banner Alzheimer's Institute Program Manager for Outreach. Heather Mulder, welcome. Are you there on the phone?
I am here. Thank you so much. And you got my name right.
Ah, right. That's great. We're going to have a good show. We're going to provide very good information. I believe our community, we basically reach the Hispanic, Spanish prefer and English prefer Latinos. We try to reach both those that prefer Spanish and also English, because we do have a radio show in Spanish on Tuesdays and in English on Thursdays. I also have Dr. Wickland, and I really want to pronounce your name right.
You got it right.
Dr. Wickland is a medical doctor, a neurologist. I had to practice these names at home, believe it or not. Neurologist from Barrow Neurological Institute. Did I get it right?
You got it all right.
All right. So again, please close to the mic, because this microphones are very sensitive. I also have Angie Garcia, and Angie Garcia has a Bachelor of Science in Clinical Research Specialist. She's a clinical research specialist for Barrow Neurological Institute. And Angie Garcia, thank you so much. Welcome to our show.
Thank you.
All right. And last but not least, Jason Resendez. And again, it was great to meet you, Jason. Yesterday, it was very pleasant to meet you. And I was at an event held by Latina Strong Foundation, which is an amazing organization here in the Valley. Petra Fimbres and Annabelle and all Miller, Miss Miller, Monica, and all the rest. It was a great engagement, getting to know people and getting to know more about what's happening in the realm of Alzheimer's. So again, Jason Resendez, he is the executive director for Latinos Against Alzheimer's Coalition. And this is basically convened by Us Against Alzheimer's. So first of all, I want to get your feeling, Jason. How do you feel about this show, that it happened? I mean, you had to go back to DC, and I asked you if you could change your plans, and you managed to do it. So we can have this show.
Of course. No, I was happy to, and very grateful for you providing this platform
not just for this topic, but for all the topics that you cover. I'm a big fan from DC watching and streaming. So really appreciate your lending the microphone literally to us on this issue, and to Adriana Perez for making the introduction. Adriana has been an amazing leader with Latinos Against Alzheimer's since we were founded about 4 years ago, convened by Us Against Alzheimer's, and helping to make connections to the National Association of Hispanic Nurses, which has a large chapter here in Phoenix. And so we've been working with Petra and Annabelle Thompson to really start to drive connectivity around the work of institutions that are right here in your backyard. Barrow Neurological Institution's one, Banner Alzheimer's Institute is another, and helped us build community bridges between the essential work that they're doing from a research perspective, from a care and services perspective, into the community, particularly communities that are hard hit by the disease like Latinos.
Got it. Let me start with a very simple question, and I want to ask Dr. Wigland, neurologist. Oh, this word is going to get me, huh? Neurologist.
Yes. It's okay, it gets me too.
Neurologist from Barrow Neurological Institute. Help us understand, Dr. Wigland, in very brief, simple terms, what is Alzheimer's?
So Alzheimer's would be a type of dementia. And by dementia, I mean that an individual is having memory or some sort of thinking change in their brain because the brain's not working well. It can be caused by a number of different disorders, with Alzheimer's disease being the most common. So all Alzheimer's disease is dementia, but not all dementia is Alzheimer's disease. There can be other things like strokes, water on the brain, tumors, a variety of other degenerative diseases like Parkinson's that can also cause dementia. But Alzheimer's is the most common.
Right. And so could we say that what people think usually as dementia is forgetfulness, and then maybe it gets intense, it intensifies kind of thing?
Yeah, it is something that does worsen over time, and it can be very hard to pick up on. There are some mild forgetfulness that happens with aging. Unfortunately, our brains do change with age, but this is a little bit more intense than that. It's more consistent, persistent forgetfulness that then does over time start to interfere with one's ability to do their usual activities and needing assistance from others.
Right. I want to go back to Heather Mulder. Heather, the state of dementia here in our state. Can you help us understand what's going on? What is the state of Alzheimer's, dementia, overall brain health among Latinos and all people?
So Arizona is on trend even more so than the rest of the country. In the United States, we're looking at an explosion in the numbers of people affected by Alzheimer's disease, both with the disease and caring for someone with the disease. Right now, I believe there's 5.7 million Americans with Alzheimer's, and by 2050, if we don't find a viable prevention, treatment, delaying the onset, we're looking between 11 and 15 million Americans with Alzheimer's disease. And Arizona is almost even above that trend. We're looking at significant growth rates just because of the aging of the population in Arizona, and then also the growth in diverse populations in Arizona as well.
Amazing. Jason, what is your assessment, your take about this matter, particularly with Latinos?
Sure. No, I think Heather outlined the general trend really well. The Latino community will be particularly hard hit by Alzheimer's for a couple of reasons. One is the number one risk factor for Alzheimer's is advanced age. And so as Heather pointed out, our society generally is getting older, which is, generally a good thing, right? We're controlling heart disease, diabetes, so cardiovascular health is improving. And so we're living longer lives, and that's great. That's important. But one of the side effects of that is an increased incidence of dementia and particularly Alzheimer's disease.
Got it.
And so in the Latino community, the Latino older adult community, Latinos living 65 and older, will increase dramatically over the next 20 years at a much faster rate than the non-Hispanic white community. So we see that in Arizona. We see that in other big states like Texas and California. And so what that has resulted in addition to other risk factors like cardiovascular disease and heart disease, is that Latinos are about 1.5 times more likely to develop Alzheimer's than non-Hispanic whites.
Right.
We've worked with the USC Roy Ball Institute on Aging to do an analysis of the growth of the disease in the Latino community, looking at risk factors like diabetes as an indicator. And what we found is that there are around 400,000 Latinos today living with Alzheimer's disease, around 2 million caregivers for those individuals living with Alzheimer's disease. Those are conservative estimates. By 2030, that number will reach to just over 1 million Latinos living with Alzheimer's disease or another dementia. By 2050, there will be nearly 3 million Latinos living with Alzheimer's disease if we don't change the trajectory.
Right.
Now, that comes at a tremendous cost to families in terms of emotion, in terms of finances, and I'm sure we'll talk more about that.
Yeah, let's do that in the second segment. We'll pick up the risk factors, and what can we do to or at least be aware of what those triggers are, Stay with us. You are listening to AARP Arizona Hispanic Connection. The subject today, Alzheimer's does not discriminate Latinos. We'll be right back.
¿Qué tal, amigos?
Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection. The subject today, Alzheimer's does not discriminate Latinos. Alzheimer's does not discriminate Latinos. Let's talk a little bit more about the risk factors, because this, I'm trying to get a hold of this matter of Alzheimer's. There seems to be, there's an attempt to find a cure for it, I'm sure.
Yes.
Then there's a line of finding the reasons why through research, clinical, research, etc. But what are those signs, doctor? What are those signs that somebody could begin to pick up?
So the first thing is typically memory loss, and it's memory loss for new information. So it's not things from a long time ago. Often we can remember the same aspects of our childhood or younger years that we could before, but we have trouble remembering new things that are taught to us, or a recent conversation we had, a recent event we went to. And it's usually hit or miss at first. Sometimes we remember, sometimes we don't.
Right.
But over time, it becomes more persistent in the types of things that we forget.
Mm-hmm. So that would be the main sign.
Yes.
You may notice it yourself, or a family member may start picking
Very
up.
often it's the family member that appreciates it more than the person afflicted themselves.
And I understand, Angie, that if that is it's convenient for a family member to participate, in doctor visits, etc., because maybe the person might not be willing or to reveal anything, but then maybe somebody else.
Yeah, usually the caregiver or the family member that's bringing the patient into the clinic will notice those differences first. And sometimes the patient themselves could be in denial of that and not even recognize it themselves that there are some issues with their thinking or memory.
And it's not exactly denial. And Alzheimer's itself, it affects the part of the brain that lets that person know that there's a problem. So because they have this disease, they don't even know that they have a problem.
So from what I gather, okay, so the Alzheimer's is part of dementia. It's forgetfulness, and it can get intensified. We have noticed, this the signs. But let's get to the risk factors. And let me start by going, because we cannot forget Heather, right? Heather, can you help us a little bit with the risk factors? Because if it's not a simple thing, if it's not a disease that I can, maybe like blood pressure, I can immediately know, oh, I have a headache, so maybe my blood pressure is not. So what are those? I guess what I can do to perhaps not get that disease. Are you there, Heather?
Perhaps not get the disease. Can you hear me?
Yes, go ahead.
Oh, okay. I'm glad, as I was saying, I'm glad to hear you said perhaps not get the disease, because unfortunately right now, there is not one thing, like you said, point to blood pressure, that you can lower your blood pressure and that means you won't get Alzheimer's disease. Right now there are risk factors, things that you have no control over, that will increase or decrease your risk of developing Alzheimer's. Things like your age. Age is the greatest risk factor.
Okay.
Things like your gender. Women are more likely to develop Alzheimer's disease than men. There is also a genetic connection to Alzheimer's disease. More than likely, if someone has this genetic connection, it's going to increase your risk. It's not going to determine that you develop the disease or not. Then there's also lifestyle factors that come into play that, again, will increase or decrease your risk. Heart health is incredibly important. People with heart conditions, high blood pressure, diabetes, heart disease, high cholesterol,
The main ones.
have a higher rate of developing Alzheimer's disease later on down the line.
Wow.
Then we look at other things like diet, physical activity, social and mental activity. It's really adopting a heart-healthy lifestyle is likely the best way to reduce your risk of developing Alzheimer's disease.
Thank you so much, Heather. And Doctor, here again, the lifestyle seems to always be
Always comes
a
back to that.
big factor in not only Alzheimer's, but in many, many conditions.
Absolutely. We cannot get away from that. We have to stress that. That it's very important how we live our lifestyle. We're built to live a certain way, and that is to be physical and to be on the move all the time, to be using our bodies, using our brain, and eating healthily. And it really is important. We actually estimate that we could prevent or delay about 30% of all dementias just by being heart healthy.
Wow, amazing. So, it's and let me come back to you, Jason, because I was talking with my wife as we did our walk this morning. We try to walk for 45 minutes to an hour every morning, and I was basically chatting with her. And I'm sorry from what I'm about to say, but it seems like being poverty is like a curse. It seems I have one of your questions, Jason, and you said that socioeconomic factors also can affect brain health and other related related diseases like Alzheimer's. How is that?
Yeah. So that's a good question and perfect dovetail into what we're just talking about. When we think about lifestyle, we think about heart health. We think about all those things that we can do to perhaps reduce risk for dementia and ultimately Alzheimer's. Those things are shaped by our socioeconomic status. The idea of having the privilege to live a heart-healthy lifestyle, the privilege of being able to do things like yoga classes or have a membership at a gym, live in a neighborhood where you have access to a park where there's no violence and you can use that park. there are all these things that poverty shapes our ability to access that lifestyle. And so now we're seeing within the Alzheimer's and community a greater appreciation for the social determinants of brain health. Because we're also, while we wait for the research to happen and for us to better develop, drug-based interventions, we're better appreciating the ability to reduce risk, to reduce that incidence, perhaps. And because of that, we have to better appreciate sort of what are the barriers to those lifestyle changes that folks can make. And unfortunately, those barriers are more prevalent for folks at lower income, lower education levels. And there is a lot of emerging evidence around education, sort of the quality of early childhood education,
Which
how that
kind
builds.
of goes hand with hand.
Exactly.
Hand with hand.
Yeah.
Because if you don't have money and you don't have access to all those things that you just mentioned, then that also tends to affect education and awareness. And let me come to you, Angie, because from what I'm learning, and again, this to me is a big learning. As I'm doing this show, I'm learning. There seems to be no way around it. I mean, with age comes a high probability that we'll suffer some form of dementia, Alzheimer's. You work in clinical trials.
Yes.
That's you work for Barrow, and that's your expertise, your area. What do you see in the day-to-day when you carry out these trials?
We really do get to know our participants really well through these trials because they go through a couple of years of these trials. And so we get to know them really well. So sometimes you can see them progress and sometimes you see them improve. You see a very diverse kind of how it works. And sometimes it's really saddening because you do get to know them really well. And day to day, like when you have a visit, it's definitely like a hustle and bustle type of thing. You have a lot of folks that are part of these visits that factor in a lot of important data that we're collecting. And so we really do get to know our participants really well. And it's really a hit or miss sometimes because sometimes you can see an improvement and sometimes you can see it just get worse.
Yeah. We have a couple more minutes for this segment, and I want to come back to Dr. Wigland. Help us again to stress one more time how critical it is, our lifestyle. I mean, lifestyle will affect pretty much our health in general, but I didn't know that it can also affect your mental health, your brain health.
Absolutely. And it's the most modifiable risk factor we have. Age is the number one risk factor, as we've mentioned. Genetics is the number 2 risk factor. We can't change those, unfortunately. The number 3 risk factor for dementia is lifestyle and heart health. That is the one thing where we can make a difference. And so that is incredibly important. We recommend at least 150 minutes a week of moderate intensity exercise, a heart-healthy diet, mental activity, social activity, anything we can do.
Reading, keep the mind going, learning, always learning,
Yes,
lifelong learning.
Things, exactly,
Yeah.
lifelong learning, very important.
Right. And I have a few seconds, Jason. So with the lifestyle thing, and the impact, let's just get started and then we'll continue on the next segment. But there's an impact financially let's focus on the Latino community. How big is the impact financially with caregivers, for example?
Sure. Yeah. No, I would just want to add one thing on to the lifestyle piece is, how important that is. And then how important it is to think about how we can start to engage diverse communities around lifestyle changes. So it's one thing to talk about the importance of lifestyle. And yes, we're seeing that in research, but how do we stress that importance to communities that think about lifestyle in different ways and think about lifestyle that's touched by or informed by culture? So we're seeing really interesting research at University of Illinois Chicago, Dr. David Marquez, who's using salsa dancing as a way to promote healthy aging among Latinos, because salsa dancing takes a lot of executive function.
Right.
If you've ever salsa danced, I'm not great at it, but I'm trying to get better because I want to reduce my risk for dementia in later life and by exercising that executive function. So that's the kind of a culturally tailored approach that we need to take to bring the message of lifestyle change to these communities that are facing a lot of the disadvantage that we talked about.
And Latinos love to dance. I don't know why we're not dancing more. I'm guilty of that. We need to dance more.
We should dance
right?
more.
I might be Latina, but I'm terrible at dancing.
Well, but I usually tell people dance means move.
Yeah.
To dance means you move. Stay with us. We're gonna go on our next break. You are listening to AARP Arizona Hispanic Connection. An amazing topic today, Alzheimer's. This is just the beginning. The topic is Alzheimer's does not discriminate Latinos. We'll be right back. Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. I'm your host, David Parra. I had not said that, I guess, because I'm so used to being here, and then I usually forget. Let's come back. Alzheimer's does not discriminate Latinos. Wow, I was very surprised to know that how hard Latinos are being hit by Alzheimer's. I did not know that. And Jason, let me come back to you. We understand that when Alzheimer's hit, there's always going to be the need of care, caregiving. And I mean, AARP does a lot of research about the billions of dollars worth of care that the government would have to pay if a family member or a loved one would not step into the plate. So help us understand a little bit, at least a big picture, Jason, on the financial implications when Alzheimer's hit.
Sure. No, that's a great question. I think, and I just want to reiterate the part about how hard hit the Latino community is by Alzheimer's because of those risk factors. But like all communities, like you said, Alzheimer's doesn't discriminate. This is a disease that largely lives in the shadows in many communities. In the Latino community, it's particularly stigmatized for a couple of reasons. But one of those issues is around low levels of health literacy generally, but particularly low levels of health literacy around Alzheimer's. So not recognizing the symptoms, not knowing that memory loss, extreme memory loss, is not a part of normal aging. So you don't think something's going on with your abuela if she's forgetting, a lot of things as they age. And so a lot of these issues and a lot of the cost is compounding because these issues are going unaddressed in families. And the economic toll of that is staggering. What we found looking at data with the USC Roybal Institute on Aging is that by 2030, we'll be spending around $30 billion a year in Alzheimer's related costs in the Latino community alone.
And this is by caregivers.
This is a combination of direct medical costs, but then also largely through caregiver impact.
Got it.
So by 2050, we'll be spending cumulative costs of around $2.3 trillion just in the Latino community. And a lot of that has to do with the impact on caregivers. So Alzheimer's requires intensive care, particularly at the later stages of the disease.
Got
So
it.
this is 24-hour care. This is someone who, through extreme memory loss and loss of executive function, is unable to feed themselves, bathe themselves. So they require lots of care. So often in the Latino community, that means juggling either a job and taking care of kids and taking care of someone living with whatever that condition may be. And in the case of Alzheimer's, we see caregivers leaving the workforce to be able to provide that quality care.
So that care falls into the realm of long-term care, which
Correct.
is a big item
big
in this
item,
country,
yeah.
not addressed yet. I mean,
Correct.
long-term care, and again, I work for AARP. I'm very familiar with that. It's not yet part of the equation. It is, but it isn't. And I know it's Altex in Arizona, but it's kind of tricky.
Part of that, looking at sort of the impact of that due to Alzheimer's, we have about 16 million unpaid family caregivers in this country, providing 18 billion hours of unpaid care.
Amazing.
Due to Alzheimer's and related dementias. And a lot of that is falling on
Right.
the shoulders of Latinos.
Thank you. I would like to go to Heather, but before I do, Dr. Wigland, help us understand, because when you talk about a big disease condition, one would think, okay, so you go to your primary and then you go to a specialist. But I learned that that's not the case with Alzheimer's. Pretty much the primary doctor will do the diagnosis and pretty much give you whatever it's available. Can you kind of briefly tell us how that works?
So it starts with a patient or their family members identifying that there's a problem, that it's not a normal part of aging, and bringing them into an evaluation. And that evaluation typically does start with a primary care physician, a family practice doctor, or an internal medicine doctor. Many internal medicine or family practice doctors are equipped at recognizing the signs, but we generally, as a neurologist, I do prefer to see these patients and help make that correct diagnosis, because they do sometimes get a little lost in terms of getting the right type of dementia that they have.
So what would be the transition from the primary to you in this case?
In this case, typically the primary physician would refer them to a neurology clinic.
It would have to come from him or her for them to come to you.
Yes.
Yeah. So again, but it's still, am I right to say that it's still in the realm of primary care?
Yes, absolutely.
That was very new to me. Very new.
And it's an area where, as Dr. Wickling pointed, many primary care physicians, and even in the case sometimes nurse practitioners, are able to recognize there's a low level of confidence
Yes.
in making that diagnosis. And one of the reasons you alluded to earlier is it's not as easy as identifying diabetes. There's
Right.
no blood test for
Right.
Alzheimer's yet. But that is an area of research that is taking center stage by folks like the Alzheimer's Drug Discovery Foundation, really looking at identifying a blood-based or an eye-based diagnostic. And once we have that, it'll be much easier to diagnose the disease and have an accurate diagnosis of that disease at as early a stage as possible.
Let me go back to Heather. Heather, the matter of caregiving, can you tell us a little bit more about how that is, programs available, et cetera?
Definitely. As was already mentioned, Alzheimer's takes an incredible toll on the people who care for the person with the disease. And really, at this point, we don't have a medication to stop the course of the disease, to kind of slows the progression for a limited amount of time. And so as the disease progresses, the burden on the caregiver becomes greater and greater. It starts, with just picking up a couple, now I pay the bills because they've started making mistakes paying the bills, or now I'm cooking dinner, or I'm cleaning the house. As it progresses, it becomes, now I'm helping this person remember their medications. Now I'm helping them get dressed and put appropriate clothing on. Now I'm helping them take a bath, and so on and so forth. But then we also put into that the emotional toll that's putting on a caregiver. I mean, that's potentially your mother or your father that you're now helping to get dressed, or maybe it's your husband or your wife that you're now helping to bathe. And so this just becomes kind of an all-consuming role for these caregivers. We, through Banner Alzheimer's, offer lots and lots of caregiver education. I think really, knowledge is power, and understanding what this disease is, getting the appropriate plans in place at the right time is of paramount importance. Understanding the toll that this is taking on the caregiver. We spend at Banner Alzheimer's a lot of time educating on ambiguous loss, which is kind of a different, unique type of grief that a caregiver of someone with dementia experiences. It's essentially, a lot of times we tell caregivers that they're grieving, which implies closure, and there's not closure with Alzheimer's disease. We can't say anything in definitive terms to them, and so it's learning to live in a world that has become very gray, which
Got
is
it.
uncomfortable. We like things to be black or white. We don't like it in the middle, and so it's teaching caregivers to live in that middle.
Right.
And take care of themselves as well.
Thank you, Heather. Coming to you, Angie. I know that you deal with the Latino community, and in yesterday's meeting, it was very, very evident that language is a big, big issue when it comes to the experience of Alzheimer's, be it from the one who is suffering in or the caregiver. Can you relate just a little bit about those challenges that language is posing to us?
You have a lot of folks that come in and might have mom and dad that might have an issue with their memory and thinking. And then the next thing is, well, they only speak Spanish. Mm-hmm. And unfortunately, there's a bit of a lack of resources for us to be able to provide that kind of care in that language. So we're definitely trying to make sure that, we're trying to not only on my half to encourage other folks who are in the medicine that know Spanish and try to get them involved, but also be that resource for them to be able to do that. So that's kind of where we stand with that language barrier, is that sometimes we just don't have enough people to be able to provide that care to them in Spanish. And we have a very large population here in Arizona where most of our older folks only speak Spanish.
Now, am I understanding this correctly? Are you talking about from the caregiver who potentially would do this for pay? And eventually, even if that's not what you were relating to, but as a side point, I believe that eventually having caregivers that will do this for pay will be a big issue, right? In other words, people who speak Spanish would have to come to be trained and be caregivers, again, for pay eventually. Can anybody say something a little bit on that?
I think maybe Jason might be able to
Sure.
answer that.
Well, I think one, you hit on an issue that's huge in Arizona, but also across the United States, particularly in places where there are large Latino populations, where our health infrastructure is not equipped to provide services, and especially not equipped to enroll these folks and give them the opportunity to participate in research. So it's an equity issue. Okay. We know that these communities that are Spanish dominant are more likely to be older. And these are the folks we want and need to understand how Alzheimer's is developing in this population. And so it's an equity issue. In terms of the language around caregiving, unfortunately, there is not a lot of support that exists from a financial perspective for caregivers. That's why we're focused at Us Against Alzheimer's on policy solutions to address these issues. Things like paid family leave, enabling caregivers when they leave have to take time off from a job to provide that care, particularly for folks at later stages of the disease, that one, they have a job to come back to, and two, that time that they take off is they're compensated for that time.
So policy it plays an important role, especially on the financial side.
It plays a role
things.
on all the sides. We have the policy change is what's going to improve on our ability to close the language gap. It's going to improve on our ability to hold institutions accountable for not including diverse samples in their studies.
We have to go on our last break, but let me just say this. anything, and especially this matter, requires collaboration from lots of entities. Are we getting that collaboration briefly?
We're getting there. It's
Getting
been a
more,
really
but not adequate still?
and not adequate still. But we're seeing more resource from NIH in funding Alzheimer's research, and part of that is because of the collaboration that's happening between institutions, including institutions right here in Phoenix, like Barrow, Banner, and others who are working together to address these issues with community partners like Us Against Alzheimer's.
Thank you. Stay with us. You're listening to AARP Arizona Hispanic Connection. The topic today, Alzheimer's does not discriminate Latinos. We'll be right back. Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. We have an amazing show today. It's just the beginning. I mean, we can kind of see the how critical it is to collaborate and for the community to understand who's involved, who has efforts, who's doing what, and then to bring the policy makers, to the legislators, to understand the issue, and then have the will to bring it to committees and laws and all that kind of good stuff. We have our last segment, but I think it's one of the most important segments of this show, and it's the following. We understand that there needs to be lots and lots of research done, and unless Latinos, and let's focus on Latinos for this show, unless Latinos participate in clinical research, it's going to be very difficult to continue to learn about this condition. And Angie, this is where your job falls, right? Help us understand how critical it is for that Latinos participate more in clinical research, and it also explains what is that clinical research.
So clinical research in general is basically we're doing research with people that might have some kind of memory or thinking issue, right? And that's specifically for Alzheimer's or cognitive disorders. And basically is that, we're doing memory and thinking tests and collecting like family history and things like that in order to understand clinically what's going on. And so we also have the opportunity to be able to in the realm of clinical trials, testing out investigational drugs that might be able to help and discover a new treatment to help slow down that process.
We know that in the Latino population, there's probably different genetic risk factors than there is in the white population. But we don't know all those genetic risk factors because we don't have enough Latino participation in research to better understand that. We're trying to develop biomarkers. By that I mean a blood test or an imaging test of some sort that can help us diagnose it better. But the same type of biomarker blood test might be good for a white person is not good for a Latino person. And especially when it comes to drugs, we can metabolize drugs different based on our ethnicity and our race. And about 20% of drugs are not going to be effective in one particular population when they aren't another. So unless we have more Latinos participate in research, we're not going to be able to help them with Alzheimer's when we hopefully can find a cure for this disease.
Right.
And
Go ahead.
I'll just kind of turn it on its head a little bit. It's one about participation, but we can't put it all on the shoulders of the Latino community.
Got it.
Right? It really is about inclusion. It's about institutions at the federal level, state-based institutions like Banner and Barrows, intentionally engaging and including the Latino community in research, so outreaching to them. So there's certainly awareness that needs to happen around the importance of research, what is research within underrepresented communities, but also there needs to be intentional outreach and engagement. And I think the language issue is a really good one where you have, and there's evidence around Latinos raising their hands saying, yes, I want to participate in your research, but I only speak Spanish. And so if those folks are turned away, how are we being inclusive?
Right.
How are we supposed to facilitate participation? So I think it's important, to your point about collaboration, about building those bridges and doing it in a persistent and long-term manner.
Heather, your take on clinical research, what your institution is doing, et cetera.
So we actually have coined 2019 the year of diversity, where we're trying to reach out to different populations that we've potentially not worked with in the past. And so in September, we are putting on a mini conference completely for the Latino population. We're getting back to basics with this information, just very general information about Alzheimer's disease. You know, it's about stepping out there and becoming a trusted resource for this community. So we've started working with the Hope Network of promotores here in Arizona as well. We're working on translating some of our materials. I know there needs to be this whole infrastructure built that we could support Spanish speakers in clinical trials, and we're not at that point at Banner Alzheimer's Institute yet, but I feel like this is a good first step for us. It's so important that we get information to the people who are impacted by this disease right now.
And just Heather, on September 13th, there's going to be 2 conferences, correct? One in English and one in Spanish?
That's right. They're happening simultaneously out at Banner Estrella, which is 9201 West Thomas Road in Phoenix. And we will have a track that's going in English and a track that's happening at the same time in Spanish.
I applaud you for that. This is great.
I'm sorry?
I applaud you for that. This is very, very good.
And I like to
Thank
say
you.
that
It's been an incredible initiative, and I've been so grateful to partner with ASU, who has been working with the promotores to raise their health literacy and help them connect with the community as well. So they've been a huge help in making this possible.
Great. Go ahead, Doctor.
at Barrow, we are offering our first study for Spanish speakers only, which Angie has the privilege of helping us run. So you do not have to be proficient in English to participate in this study for Alzheimer's. It's part of our Arizona Alzheimer's Consortium, which is a longitudinal study for individuals afflicted with Alzheimer's, but we're specifically targeting the Latino population and Spanish speakers.
Good. I just want to say, and please hold that thought, it's September 13th, 2019. Because if somebody watches this video in 2020 or whatever, I just want to make sure that they understand, that they know that this is September 13th, 2019. Go ahead, Angie.
So I am very blessed with the privilege to be able to at least have one study where I will be able to conduct all of the visits in Spanish and even interpret as well for certain portions. So I'm hoping my target is sometime mid-July, early August. Usually if I give myself a deadline, it helps. But it's, as Dr. Wicklund had mentioned, it's a longitudinal study. It's for as long as the participant's willing to participate. All research is completely voluntary, so they can refuse to participate or they can withdraw at any point in time. And it's provides so much useful information, and we're looking for folks with, who might not have subjective memory loss. So that means that if they're noticing any differences, or folks who have already been diagnosed as well, because we need to see it from all the stages in order to understand or hopefully pinpoint where it's happening, or at what stage it could be progressing or things like that.
Yeah, before we finish, let's kind of wrap it up in terms of what organizations, businesses, entities are represented here and how people can get a hold of you. Just by looking at my guest today, I can see Jason, Latinos Against Alzheimer's Coalition. That's a national, I assume, a national. So it's going to be difficult for Phoenicians to kind of, or the Arizonans to tap into that. And then you, Us Against Alzheimer's. Is there any form of to tap into that research?
Yeah, so if you
Facebook
go,
page or whatever?
Sure, yeah, go
of
to
those two entities.
Those two, you can find Latinos Against Alzheimer's on Facebook. So please look for us there. We do a lot of updates on Facebook. You can go to usagainstalzheimers.org and sign up for the Latinos Against Alzheimer's newsletter, etc. And then right here in Phoenix, we work with Latina Strong.
Okay.
To do a lot of outreach to the community, and so they're a great resource as well.
They would know about your efforts if asked.
Yeah, that's
good.
right.
So let's go now to Banner Alzheimer's Institute. Heather, what do you have for the public that is interested in reaching out, learning more about these matters?
So we are located in Central Phoenix, on the Banner University Medical Center campus, so 7th Street in McDowell for you Phoenicians. So anybody is welcome to stop by and visit. Also, we have our website where we put all of our information, all of our printed materials are on there, and people can print them off. That's banneralz.org. Finally, if you're interested in attending a class or coming to that event on September 13th of 2019, please visit us on Eventbrite, and that's banneralz.eventbrite.com, and you're able to register for any of our upcoming classes on there.
Thank you. Doctor, before we go into Barrow Neurological Institute information, I just have a quick question. Sure. Is there a correlation between Alzheimer's and Parkinson?
Age is still a great risk factor for both. They're both what we call degenerative brain diseases, which means that the brain is not working right, getting worse over time. And having one does increase the risk for other. We frequently will see both happen in the brain.
Got
as
it.
we get older, yeah.
Okay, so contact information for Barrow Neurological Institute. Do you want to give that information, Angie?
Yeah, of course. If anyone is interested in any of our clinical trials, you can contact us at 1-800-392-2222, and that's for all of our clinical trials in general. So for some of our other trials, like any investigational drug trials or things like that, you do have to be proficient in English, but we are looking for a diverse group of people. And that's 1-800-392-2222.
Anything online?
You can go to barrowneuro.org.
Okay.
You can find us online at barrowneuro.org.
Right. We have one more minute, and I would like to just ask you to, so what are the 2 or 3 forms of clinical research that happens, just briefly?
So the one that we're focusing on that I can do in Spanish are what we call longitudinal observational studies. So they can go for a long period of time, and we're just looking at kind of how the symptoms progress and things like that. We also have what we call interventional trials, which then could include a new device or a drug or investigational drug of different kinds.
That is being tried, pretty much.
Yes.
Jason, I'll give you the last word. What would you say? What would be your final words? I know you're going to be leaving to D.C. in a short while. You were here in Arizona. Final words related to Latinos and Alzheimer's. What's your takeaway or what you want to communicate to our community?
Yeah, I think it's be open and sharing your story if you're connected to the disease or think that you know someone, a family member or a loved one that is dealing with extreme memory loss, dementia or Alzheimer's, to take advantage of the resources that you've learned about today and raise your hand and help to be a part of the effort to stop and better understand this disease.
Thank you. Heather Mulder, Dr. Wickland, Angie Garcia, and Jason Resendez, thank you so very much for joining our first show of what I hope to be just the first of many to come. And thank you for joining us today. Hope you learn a lot, and we will continue to address this matter because we believe it is very important. Have a great day. See you soon.
Thank
Thank
you.
you.
Thank you.
Thank you.